You've got a kind of large proportion of Sinovac compared with other types of vaccine, other brands of vaccine. What was the strategy, the thinking?
Yeah, thank you from the Swiss Embassy. Of course, we consider several different important things. And one of them is the vaccines availability. And we want to make sure that we can access the soonest possible, the highest number that we can have, and affordable one, of course, later in the considerations. So that's why it's going to be a mix of different vaccines. Very obvious. Why? Because the availability of the vaccines in the world is also limited. So that's why, that's what we consider in terms of the vaccines available now. Thank you.
Okay, a question from Ji Zhang. There are some people, even officials, I think, who are refusing vaccination. How do you persuade them to join the vaccine plan? And where do these opposition voices, where are they coming from? And how can the central government deal with this?
Yeah, thank you for these questions. I think this is very relevant to all countries in the world since we are facing the same challenge that a new thing happening and people are not ready because they don't understand what's going on and why it's going to be vaccinated as one of the intervention. So that's why we need to have public educations more and more and more consistently and at different levels, and it has to be efficient to make sure that the general publics, and depending on the variations or distributions of the level of knowledge, culture, etc., are understood by the programmers. So that's why we do our best effort to make sure that people understand and know that to protect the whole populations, the whole society, we need to have the herd immunity. Of course, it's a very challenging one to explain about herd immunity to the general publics, especially at the rural area. But with the consistent cultural approach, with the right language, we can convince them. And if you ask me where the opposition's voices come from, apparently the opposition's voices are also coming from the educated groups as well, but they need to know more and being convinced about the vaccinations, the importance of the vaccinations, and even they want to know more about the more technical and scientific terminology. So that's our challenge, and also the expert challenge to convert the very scientific evidences and text into a very layman language so that can be understood by the general public. Thank you.
And just to follow up on that, I mean, I know Sinovac has been deemed halal, but if a vaccine is not deemed halal, do you foresee a lot of issues using it in Indonesia?
It has to be halal for the vaccines to be used in Indonesia because that's the general consensus in Indonesia because of the Muslim country. So, of course, we want to make sure that the vaccines available, even the vaccines that are being developed in Indonesia, should be halal. Thank you.
Okay. And there was just a quick follow-up that's sort of related to this from Sarah at the Belgium Embassy saying, I think she's referring to a statement from the Vice Governor of Jakarta that people who refuse to be vaccinated would be fined. Is that something that the task force is looking at or is an option?
Yes, we understand that. There are many conventional ways to address the issue of accepting or refusing the vaccinations. But then before we issuing sanction or penalties, we have to make people understand because this is the key issues rather than more on sanctioning. We have to make them understand. Why? Because the first important one is to make sure that if we want to protect the society, we need to reach the herd immunity. So that's why we need to explain about the herd immunity, why it is important, because if we are vaccinated, not necessarily that we can protect the others if it doesn't reach the herd immunity. And vice versa, if this vaccine will be effective to us as an individual, that not necessarily will be 100% effective, because as we are learning and in progress, we see that there is a reinfection, etc. So that's why there are things that we need to learn, and we have to make sure that the public also understand about the situation so that they can accept that vaccinations is part of their effort to protect the nations, including themselves.
Great, thank you. A quick follow-up from AFR on, will the number of people vaccinated be announced? I mean, I suppose every day you're announcing the number of tests, etc. Is there any plan for the number of vaccinations to be announced?
It will be, because it's inevitable that we need to announce so that people can calculate as well how many of us or those that will be vaccinated. Yes.
Okay. Follow-up from Victoria at AP. Will the TNI be involved in vaccine distribution? And if so, how? Can you give an example of the role that they could play?
Yes. We are involving not only TNI, but also police in the vaccination distributions and protecting the system and also the implementations of the vaccinations. And one of the examples is when we distribute the vaccines to the remote areas, for example, we also rely on the armed forces to deliver that, to make sure that it will arrive in due time. Thank you.
Okay. From Amanda Hodge at the Australian newspaper, can those who pay for the vaccine choose which one they receive in Indonesia? I think this is a very interesting question, which again is global, but it's, will that be a possibility for people?
Yes, I understand about this issue. The government policy is to provide the vaccines free for the public, but about whether it's free or charged is one thing. But we have to understand the availability of the vaccines is limited. If we have money, if the funds is available, that doesn't mean that everybody in the world can access the vaccine. So that's why we want to make sure that the people in Indonesia will be vaccinated with the available and acceptable and good quality of the vaccines available for the Indonesia. So the issue is not about the ability to purchase the vaccines, but to make sure that we can access the good quality of the vaccines in due time. Thank you.
But if somebody found a supplier abroad or something, would they be allowed to import the vaccine right now?
Of course, we have some list of priorities. And if the government of Indonesia can have more access to the other type of vaccines, of course, the government of Indonesia will access that for the people. So the effort doesn't have to be individuals, but it's collective by the government. And
I just wondered if the private sector was offering to help, maybe.
Private sector is part of the Indonesians, and they can work together with the government.
Okay. A question from Izmira Lutfia at Arab News. Is the government still confident with its communication strategy to promote vaccination by involving celebrities and influencers? And you're referring to a situation with Raffi Ahmad, which I think went a bit viral after his vaccination. I think there was some pictures of him partying or something. But yeah, so are you happy with this strategy of involving celebrities and influencers?
Yeah, of course, we have to be mindful with all possible incidents when we have, a big programs like vaccinations. And we hope with the big influencer like Raffi Ahmad, we hope that he can play a pivotal role to make sure that the young people will support the vaccinations. And things can happen, a glitch can happen. And of course, it has been clarified by himself. And of course, in the future, when we have more people vaccinated, including influencers, we have to work together in a communication strategy so that it can be carefully, adopted by them and also understood by the followers. But that, this is an important policy by the Indonesian government for all people. Thank you for the questions.
Thank you. And just a question from Sil, I'm not sure where they're from, but what other brands of when the other brands of vaccines are available, will the government give flexibility for people to choose the brand that they're getting?
I guess I already answered that. So we
answered that.
Yes, vaccines available.
Yeah, okay. And there's a question from Robert Nasir at CIFA again. What's the actual process to register to get a vaccination? Do you have to register?
Yes, of course. We want to make sure that the vaccines developed in the world also recognized or registered, to WHO, and then the process of the vaccine development is also transparent to public. And of course,
I think it means just to, if an individual wants to get vaccination, how do they have to register as a person?
Yeah, of course. Yeah, they have to register in a system because we have a digital systems in the government of Indonesia working with the state-owned company and to make sure that all of the people are registered. And one of the examples is myself. I received a message in my text that I will be vaccinated in where, and I just follow that and we can get the results, the card, etc.
Okay. And another follow-up from Natalia. Do people who are going to be vaccinated have to be tested COVID-free first? And what would be the effect of people who don't know they've been exposed to COVID get vaccinated? That's an interesting question.
So of course, the people that will be vaccinated has to be tested, PCR, that is COVID-free. And then if they don't know and have exposed to COVID, get vaccinated or not, of course, it will be tested first. And then if we know if it's positive, then probably it will not be vaccinated.
Okay. I think you've already answered the question on Rafi. So just from Amanda, again, you say public health measures are more important even than vaccination. But what do you say to criticism the government words do not match its deeds and that its latest restrictions are not serious, i.e. reducing mall hours by just 3 hours, while at the same time allowing domestic airlines to fly at 100% capacity?
Yes, we understand that there are mixed probably signals, but we want to make sure that our communications to public and also the compliance of the public to the government announcement, regulations need to be improved from time to time. But this is in the pandemic era, we are challenged everywhere in the world, of course, and we have to improve from time to time. Thank you.
Okay, from Tria Dianati at Manaichi Shimbun. So how many years will it take to vaccinate all the people in Indonesia? And then a follow-up, any possibility of a paid vaccine?
Yes, it's challenging questions, not only to Indonesian, I guess, to every countries in the world. Right now, as far as we know, there are 11 billion people that need to be vaccinated and only 6 billion vaccines probably available to support, including Indonesia is part of that. And in order to vaccinate or to cover the vaccinations target in Indonesia, it takes time. But in terms of ability to vaccinate, according to the Minister of Health, it takes about 8 months in terms of the capacity to vaccinate the infrastructure. However, it takes longer to get the vaccines available. So that's why the estimation at this moment, it will take about 15 months. And of course, the time cannot be fixed because the development always improve from time to time. So at this moment, that's the situation.
Okay. And a question from Wahyudi at Straits Times. Can you confirm Indonesia is doing pay your own vaccination Mandiri program, and when would this start? And would people be free to choose which vaccine or government pick based on profile or age?
Up to this point, we don't have the Mandiri program, and we will measure the situations. Of course, the Mandiri program will be available when the vaccines availability in the world improve much, including the vaccines that are produced by the Indonesians.
Okay. And just a follow up from Amanda on this, just whether private individuals or companies will not be able to import a specific vaccine for their own employees.
I think if the private companies can import the specific vaccines in high numbers, of course the government will import that first, because the private individuals or companies are part of the Indonesians, because the government is trying to do our best to cover all members, regardless whether they are public servants or working at the companies.
And if a particular business wanted to offer to organize its own vaccination for its staff, would that be allowed? Or would that not go outside the current system?
I think if all of the private companies and individuals can organize themselves to import the vaccines, of course the government will also join that. So that's why this is a joint effort. This is not a competition between groups in Indonesia, because the vaccines available in the world is so limited.
Right. Okay. Just a couple of follow-ups about the specific ways that if you're not a civil servant, will you receive an SMS that tells you you're eligible for vaccination?
Of course, some of the non-civil servant or the general public also receive SMS, as far as I know. And of course, that means that they are eligible for the vaccinations.
Okay. And just a follow up from Stephanie at the German Embassy on the saying that foreigners might have to pay for the vaccine. I mean, how about foreigners that are covered by the BPJS health insurance?
We have not discussed in details about the relations between the foreigners and how they will be covered or be paid for their vaccines and its connections with the BPJS or other scheme. But of course, this will be dealt later.
Okay, and a follow-up from Victoria, just how is the 15% wastage rate for the vaccine calculated? Is this an average wastage rate for Indonesian vaccination efforts?
Yes, this is part. It's drawn from the experience from the previous vaccinations program in Indonesia.
Okay, I just had a quick question on the hospital system, how it's coping right now in hotspots in particular. I mean, I've heard Banten, maybe it's quite stretched. Do you have updated any information on how hospitals are faring?
Yeah. The bed occupancy rate for the isolation room as well as the ICU are becoming limited, and it's above 80% at this moment. So that's why the government of Indonesia implement a stricter policy, at least in areas or provinces in Java and also Bali, as they contribute more than about 60% of cases in Indonesia. So therefore, hopefully the pressure to the health systems, to the hospitals bed will be reduced in the near future. And we will see the development closely every day. And we want to stop the pressure to the health systems by more rigorous health campaign, health protocols campaign to the public. So we cannot provide more resources in the healthcare systems with the problems like pandemic, like COVID-19. So that's why prevention is much more important than curative. Although we want to make sure that people who are sick are well treated. Thank you.
Okay, and just to follow up from Amanda at the Australian, given concerns over Sinovac efficacy, will people be allowed to refuse Sinovac and asked to be put on a kind of waiting list, I suppose, for another vaccine that might be more effective?
Yeah, logically, that sounds right. But when we are dealing with the pandemic, we are dealing with the virus, we are not dealing with the government policy. And the government policy really want to protect the people. And sometimes, or most of the time when it's not in the pandemic, we have choices. But in the pandemic, we don't have much choice. And we want to make sure that they understand that we have to move forward because we want to run our life collectively. And that's why herd immunity is so important in the vaccinations program to be understood by them.
Thank you. And just to follow up from Natalia, just with the increasing number of cases and shortage of beds, is the government planning to build a special COVID hospital or another COVID hospital, I suppose?
Yes, of course, we are trying to expand the referral hospitals for COVID-19. But as I said, we cannot have more and more beds provided for the COVID-19 as a referral hospitals because we are not dealing only with the COVID-19s in the Indonesia. We have other health problems in Indonesia, so therefore the best solution is not only providing more beds, but we have to have more rigorous and strong, effective prevention programs, which is health protocols adopted by the people with the different approach and cultures in Indonesia. Thank you.
Okay, well, thank you very much for being very open today and on this important issue. And we'll be looking forward, I'm sure, to having you again in not too long. We've also, just for our other members, we're also having Sri Mulyani, who will be speaking to us on Thursday, the 21st of January. So obviously she'll be very focused on the economic impact of the pandemic. But I'd like to thank you very much, Professor Wiku, for your time today.
Okay, thank you, Mr. Edward Davis, the president of the Jakarta Foreign Correspondent Club, and all of the correspondents and international media for the sessions. I appreciate that we can have interactive conversations and fulfill of the information that you require. Thank you.
Thank you. Thanks, everyone else. Happy New Year.
Thank you. You too.
See you soon.
Thank you.
Thank you, Professor Wiku and Mr. Davis. That was an insightful session indeed. We hope that the event was able to convey our efforts in managing this pandemic in the country, especially our vaccine procurement and distribution efforts. With this, we bring our briefing to a close. Stay safe, stay healthy, and until we meet again.